Hello, my name is Leah Merrifield, and this is my project on post-surgical rehab for the Kidner procedure. To fully understand the necessity for rehab, we will talk about the purposes for the procedure, the anatomy of where the procedure takes place, the reasoning for this surgery, and how this procedure itself is performed, along with the rehab process following the surgery. For purpose and statistics. So, what necessarily is the Kidner procedure? This procedure simply is the removal of a bone called the accessory navicular. This bone is not common as it is only seen in about 10% of the population, and out of the 10%, 70% have it in both feet. This sesamoid bone forms as an unfinished fusion of the navicular, which happens at birth, so people are born with this bone. It is more common to see the accessory navicular in females, and those with this extra bone typically show symptoms through the ages of 10 to 20 years old. Though it isn't very common for people to actually show symptoms, as most people do not know it is there, and pain only arises if there has been constant irritation, a sudden impact, or constant pressure. For the foot anatomy. So, what is the accessory navicular bone? This bone is an abnormal development and is considered a sesamoid bone as it is embedded in the posterior tibial band. It is located medially and adjacent to the navicular. So, when it comes down to it, when would surgery be necessary? Before surgery, there are routes taken which can hope to ease pain and fix the issue of pressure or irritation on the accessory navicular. Since pain usually does not arise in those with this extra bone, when symptoms are presented, there are a few things that can contribute to the pain that actually could solve the problem without surgery. Those include temporary immobilization, orthotics or arch support, proper shoes, padding, and or compression. The reason for orthotics and getting proper shoes is very important as those can provide proper support and room for the accessory navicular. The accessory navicular bone protrudes further than the navicular on its own, causing the wrong fit of shoes to constantly irritating. Furthermore, it is common for those with an accessory navicular to have a flat arch further pulling the posterior tibial band, which in return is pulling the accessory navicular. With proper foot support, the pain can relieve itself in a given period of time. With the non-surgical treatments, they may need to be tested for a generous amount of time as there is something the foot has to get used to. So when does surgery become necessary? When the accessory navicular has become irritated, there is constant pain, it is tender and sensitive on the medial plantar part of the foot, and all of the non-surgical treatments fail to ease pain. So what are the reasons for this pain? The reason why pain is so prominent in this scenario is because the impact that has or is happening disrupts the fibrous tissue between navicular and the accessory navicular, and the fibrous tissue is prone to poor healing. Another reason being improper footwear causing constant irritation. Additionally, as previously said, the posterior tibial band attaches to the accessory navicular and is constantly pulling on the bone. The Kidner procedure is performed by detaching the accessory navicular bone from the posterior tibial band, removing the accessory navicular bone completely, then reattaching the posterior tibial band. And if the patient has a flat arch, tendon will be advanced and tightened to provide higher arch support than it is sutured with stitches. The surgery itself only takes about 45 minutes to an hour, and the patient only needs to stay in the hospital for about 2 to 3 hours post-surgery. Now into the rehab process following surgery. Elevating is very crucial within the first 4 days to decrease swelling. The pain will be very excruciating within these days, so keeping your movement limited is important. From weeks 2 through 4, stitches will be removed. The switch from a plaster cast to an integrity fracture boot, which is basically a boot just below your knee, with crutches and beginning active range of motion, hip and knee. Also focusing on exercises including the hamstring, quads, IT band, and hip flexors to maintain bilateral strength. The goals for these weeks are to get blood flow and avoid stiffness in the involved foot. From weeks 4 to 8, weight bearing is tolerated with continuation of previous exercises. And something very important is starting scar massages to prevent the buildup of scar tissue. It will be very painful, but it is very important to do this. The exercises in this include ankle range of motion exercises with resistance is tolerable. along with gastrocnemius and soleus stretching. The goal for this stage is to regain full plantar and dorsiflexion. For weeks 8 through 12, the switch from a full leg boot to an ankle boot or ankle brace will be made depending on patient's progress. Continuation of the previous exercises will be involved. This stage begins proprioception exercises along with light weight-bearing activities such as pool therapy, stationary bike, and or the Alter G treadmill. The goals for this stage are to obtain a normal gait and remove a limp and have symmetrical range of motion in both feet. Months 3 through 4 is a transition to the ankle brace and continuing appropriate previous exercises. This stage will consist of higher weight-bearing exercises such as beginning walking on the treadmill, using the elliptical trainer and or Stairmaster. The goals for this stage are to regain equal bilateral strength and be able to walk 2 miles at a 15-minute per mile pace without stopping or reaching unbearable pain. And finally, for the months 4 through 6 post-surgery, you move to ankle brace and arch shaping. This stage contains plyometric exercises and a progressive running program. But the goal by the end of 6 months is to return to sport. Thank you.